Okay, we're going to have Ms. Stewart come, and she's going to give us
Again, my name is Stewart, and I've been working with the Obama folks for quite a while now on affordable health care. First thing I'd like to say to you all is that you hear a lot of misnomers about what the name is and what do you get there. Obamacare is synonymous with Affordable Health Care and the Affordable Health Care Act that was passed in 2010. So it's all the same. In the past, Obamacare was considered a very bad name, and so it was used pejoratively to say negative things about health care. But what has happened over the year that we've been working it closely, we now have over 8 million people that have signed up for it as the problem that we started out with, and I'm from information systems. I was executive at IBM and worked on systems technology for quite a while. The problems that we had initially, we have to take responsibility for those. The Health and Human Services Executive, Sebelius, and Representative Congress is here, and you know, I'll respect him and respect him in this manner, but it was rolled out horribly, terribly wrong. And we lost a lot of ground as a result of that, because it allowed folks like Ted Cruz and others, and then the media, to jump on board to say that the program wasn't any good because of the things that they saw at the front end. It took a while for us to get the front end repaired. We put a lot of resources in it, and folks like myself then went out to then engage the public and then to get folks signed up for it. The other thing that happened was that in 2012, when the Supreme Court again supported it in a 5-4 decision, it allowed the states, though, to opt out of Medicaid insurance for their lower income folks. So you'll find that places like Texas, Florida, and others, there are 24 of those states that have not participated in the program. And as a result of that, the folks that are participating in the program they were overwhelmed by the number of people from Texas and states like that that then tried to get into this system, and what this system was called the marketplace. So they tried to get into this system over that period of time in the October-November time frame, and the system didn't work for them. For most people, it crashed. And it crashed because there were just so, you know, you could say that could be positive, but it wasn't positive for the person trying to get in and get enrolled, right? But to have ourselves sit back there and see what was happening in terms of the interest and motivation and the desire to get through it, that part was positive, but the whole thing just became this ball of negativity that rolled out across the nation for quite a while. I'll digress just a second to tell you that I was in Australia in the fall, and the folks there, they were laughing at us because we're trying to not have health care for our folks. Yeah. I mean, they said we were ridiculous. Yeah. And this is Australia, right? Yeah. It's what, a 24-hour flight away from here, and they had enough insight into what was going on here to say that we were crazy for not wanting to provide health care for our entire population of folks. So, regarding the website, regarding the technology, regarding the resources that are available to it, over the December, January, February time frame, all of that was fixed. You might not hear that it was fixed, but it was fixed. And then we were enrolling people at a clip of 500,000 folks. In March, we enrolled over 1 million people. Wow. And the last day of March 31st, when it was supposed to shut down for the year, that day we had so many resources available and so many folks wanting to get on that we then extended it to April 30th. So, and from the end of March until April 30th, we then enrolled another 1.5 million folks into the program. And on a sidebar, in terms of what was going on in Michigan with Medicaid insurance, Governor Snodgrass and his folks decided at the end of the year that they would allow Medicaid insurance to be a part of this program. And so as of April 1st, folks that have income levels below $15,200, $282, they are eligible for Medicaid insurance. So if you have folks out there that you know about who tell you that I can't get Medicaid insurance because they look at my assets, they look at these other components in terms of my income, that's not true. What's true is that it's income-based Medicaid insurance. And so therefore, if your income is below $15,000, a single person, of course it goes up from 2, 3, 4 and on, you can then go in and talk to DHS about getting Medicaid insurance. There are a couple of other things that I'd like to mention to you regarding, there are 2 commercials that have been on and they've been repeatedly going on. This Americans for Prosperity website and these folks. Those are the Koch brothers, right? Now remember, Koch brothers own Bounty products. You know, I would suggest that you all go online, technology, and find out what the Koch brothers own. Because we as middle-class Americans, we're the ones that are sourcing Koch brothers' ability to fund the kinds of programs they're funding against us as middle-class people. So you have to keep that in mind. They have a whole host of products that are under their leadership or under their ownership that you should be aware of. She has this list here, and I have the list as well. We can send this list to all of you. And then you talk to your friends and neighbors and you encourage them to figure out a way to use something else other than the products. The 2 commercials that I want to focus on right now so that you understand them, because those were the ones that kind of caused me to reflect on what is really going on here, because the first one was a very painful commercial when I first saw it. And this was a commercial that was attacking Gary Peters because he was supporting Obamacare. And there was this lady with leukemia, right? And it's true, she does have leukemia. She was at the U of M, University of Michigan Health Center. And if you listen to the commercial, I mean, it ran, right? And it's still running. And I'm not denigrating the fact that she has this illness.
That's right.
And this illness is significant. It is significant. But what the commercial led you to believe, based on her sermon, and she's sponsored by the Koch brothers, so keep that in mind. Americans for Prosperity, they're the ones that make that commercial available. What she leads you to believe is that because of Obamacare, she lost her insurance, she lost her doctors, she lost her ability to get the medication she needs, she lost all these components. Each and every one of those allusions that she makes is not true. Her premium cost was halved. So she was paying $1,000 plus on her premiums before the Obamacare program. That's less, it's now about half of that. Her out-of-pocket costs, which are high because of leukemia and those components, her out-of-pocket costs did not increase. In fact, they decreased as a result of the program. She said she would not have access to her doctors. That's not true. Her U of M center doctors are in the same network that they were in while this was going on. So when she was asked specifically, why is it that she continued to support it, she said, well, I don't believe what you all are saying. Doesn't matter what she was saying in terms of the truthfulness of it. And then she came back with a second set of ads after the first set were refuted and said, Gary Peters and the Obama folks are attacking me because I'm just a middle-class person and I didn't have health care. That's not true. Nobody attacked her. It was Washington Post and it was other outside organizations that looked at this and then came back into Michigan and said, why aren't you guys doing something about this in terms of at least giving a fact check? It's a Pinocchio kind of deal, right? Having a fact check regarding this work. So does everyone understand what I've just said?
Yes.
And the other thing, the underlying principle here regarding her is that she doesn't like Obamacare, but because of Obamacare, her pre-existing condition now can never be used in terms of any insurance that she gets any place in America. Because of Obamacare, she no longer on the amount of money that she now would receive relative to her health care. There's no cap on the Obamacare. And under Obamacare, she now would be able to go anywhere in the United States, get health care, get care, and get these issues resolved. She never ever speaks to all the benefits that are derived by the Affordable Health Care Act. Lastly, I know I've got to get off, but the second one that's been going on since that one, kind of ran well, it didn't run its course, but they had so many folks were coming in and talking about it. They now run this one with Shannon from Grand Rapids. I don't know if you've seen Shannon. Shannon's the one that looks like she's from U of M. She is not a U of M graduate. She has a U of M logo stuff in the background. In the back about that stuff, right? So you can go to Walmart and get it, right? So she then talks about the fact that she could not get the type of health care that she wanted for her family as a result of Obamacare. Now, this big lie, I won't say it's a lie. The big point that's being raised continuously is that Obama lied about your ability to continue with your existing doctor and your existing plan. Now, quickly, the reason that happened was that those plans did not meet the ACA quality standard. So so that percentage of folks that were on plans like that, those plans were deemed unacceptable plans. But because folks, said, he's lying, and this is the worst lie that's ever been told, because of things like that, he said in November, okay, keep the plans. We'll grandfather them into 2017, so therefore you can keep them. So now she can keep the plan, but she's not giving you that view that she can keep the plan that was rejected by Blue Cross Blue Shield because it was unaffordable and it had high costs on it. So when you look at that, she was saying that I can't get insurance, this thing is high. That's not true. When they came back to her and told her, this is the kind of insurance that you can get, it's less costly, it has higher quality, more benefits, and your children would be in the Medicare, Medicaid program for kids, it's called CHIP, C-H-I-P. When she was told that her children would have their separate insurance, she refused to accept it. Now you can't make people take insurance if they don't want it. You have a penalty, right? You don't take the insurance, it's $95 a year penalty for not taking insurance, for not having insurance. All right. Yeah, and then she says, well, but if you can't afford the penalty, if you can't afford the penalty exemption, there's an exemption that's in place so that you can be exempt from having to get insurance. That's in there as well. But lastly, what I'm just saying is that I need for you all of you, to talk to your neighbors, talk to your friends, and you think about yourself. The misinformation that's going out about the future of Obamacare, the future of health care, you guys have got to be strong enough to stand up and say, that's a bunch of stuff. It's not correct, and I need all of you to not only understand yourself, but to tell your neighbors that. Please do this on our behalf, okay? Because it's best for you too. The program is not going to die.
Good. Yes, I have a friend that her daughter was ill for 10 years. She was using the emergency room, as the president had explained how people were using emergency room for their care.
Yes.
And she just, since Obamacare, and the state of Michigan didn't allow the insurance to take place, aid to take place until April 1st.
Okay.
Now she has had the surgery that she needed for 10 years. We need to have people to come out and explain in groups about the various insurances so that they can have a better understanding, because a friend of mine is telling them how her medicine has gone up, but I'm sure there's something about it that the people are not aware of what they need.
Yes.
So we need help in that area for the communities.
Well, I know we don't have the time, but I would be if you'll allow, I will come back and talk about the pharmacy implications, the donut implications, where there are holes in terms of the Medicaid, Medicare program, and what's being done to ensure that we get those codes relative to improving not only the pharmaceutical issue, but also improving the codes, the things that now are not in place correctly regarding pharmacy.
Nancy Stewart, a hand, y'all. Give her a hand.